One couple in 6 in the UK have trouble conceiving, and the commonest cause is male infertility.
When couples have problems conceiving, half the time the difficulty lies with the man.
We're growing concern today about the issue of fertility following news that the average sperm count...
So should we be alarmed, and what can we actually do about it?
To level the playing field, Zeren's going to try and optimise his sperm by looking after himself, not abusing himself and eating properly. On my part, I've got to try and destroy sperm, and I'm just carrying on drinking lots of alcohol. But I'm also going to wear very tight underwear and try and overheat my testicles using heat pads. It's known scientifically that heat can have a detrimental effect on sperm. If you overheat them, they're not going to be so good. Use hot pad only for warming hands and only for a few minutes at a time.
The sperm race is going to show whether it's Mike or Zeron that's got the stronger sperm. But strong sperm are only as good as the delivery system, and that's where the erection comes in. 10% of men Mike and Zeren's age have trouble with their erections. This can be for physical or psychological reasons, most of which can be treated. I'm sending the guys to have their erections assessed by top experts at a leading clinic in London.
So after checking our balls out, today we've got to check out the delivery system, yeah? And we've got to make sure that we can get it up.
Yeah.
And that's going to be tested scientifically, yeah?
Yeah.
And it's going to be done by you, yeah?
No. What do you mean me? Do you mean both? I thought it was both of us.
Can I?
I thought it was both of us.
Specific instructions. Don't even think about it. It can't be me.
You git.
I can't, can it?
So it's got to be me.
Yeah.
I've got to do it.
Yeah.
You're just not nice. You're just not nice.
Zeren, come in. Your boudoir for the afternoon.
Oh my gosh, this is not going to be easy, you know that.
Yeah. An ultrasound machine. We're going to put this probe here.
Yes.
At the base of your penis to measure the blood flow. What this is going to do is to see whether your taps turn on.
Right.
That's increased flow. That down there measures rigidity, where there's a sensor at the base and the tip of your penis.
So this is going to measure how hard
Yeah.
my penis gets?
Yeah, or not.
Or not, as the case may well be.
And there's a DVD player there, which is going to show whatever you want it to show.
Oh, that's going to show naughty films?
I hope so.
And if I do manage to achieve an erection, right,
You let me know.
then I call you in.
You call me in.
That's going to be so embarrassing. I've got a hard on.
Yeah.
And then you can run it in.
Most of my patients that I see would be delighted.
I thought I drew the short straw when I was told I'd have to abstain for a week and wear heat pads on my balls. And to be honest, they ache. You know, it's not a pleasant experience. But there's no way I'd want to be doing what Zeren's doing. No way at all. He got the rough deal this time.
Now, what we're going to do now is you're going to put your leg up there, settle down, undo your trousers, put your knickers down, and I'm going to have a look at your classic penis with this, okay? Yeah. Now, we just get on. It's just like any other part of the body we're going to do.
For Zeren to get an erection, what exactly has to happen within his body?
Well, it's a fairly complex process, but if you get sexually stimulated, whether it's a video or whether it's a woman touching you, what essentially happens is an increase in blood flow into the penis. If I show you on this model, that in fact what you've got is these red areas represent muscle of the penis. It's actually this muscle that does the main erectile processing, that it relaxes, and this muscle relaxation causes the blood to engorge within the penis.
Blood pressure about 150/85.
Yeah.
And coming back down again though. He's having trouble, isn't he?
Yeah.
He's having trouble getting it up.
Yeah. Performance anxiety by the looks of things.
Yeah, I think I would as well. There's something happening at the tip now.
Yeah, it's going up slowly, but even then, the main amount of change in circumference does appear to be at the base. We seem to be getting some response.
What is he saying?
Somebody new.
He's got a smile on his face anyway, so it's always a good sign.
But his blood pressure hasn't changed very much, has it? It's just a very slight increase in blood pressure, very slight increase in pulse.
Although, having said that, I mean, it's for a young guy, I mean, what it was originally has gone up, I think, significantly. So, hopefully, things are working.
I'm going to call him Dr. David. David! David! Hello.
Boy.
Hello.
Let's have a look.
Yeah. Anyway, just...
no, you just relax.
Okay.
Relax. You just relax.
Yeah.
Just let me just do my job.
If David can get a blood flow reading here and just show you that there probably is an increase in blood flow.
Right. Well, it's quite interesting. He's done well. He's got actually quite a good degree of tumescence. There's no argument about that, but not rigidity.
So tumescence.
Tumescence.
For the layperson.
A penis getting bigger.
So he's getting
Bigger
bigger.
and bigger. Rigid is the extreme of tumescence.
So in your judgment as an expert, we know his sperm count, we know the size of his testicles. Has he got what it takes to deliver it properly?
I'm certain he has.
Oh, that's good news for him.